Hello everyone, this is next in the series of image to diagnosis under fetal medicine and cyst in a case of cyst in the fetal pelvis. Now this is a fetus at 22 weeks of gestation. Previous scan has been reported as intra-abdominal cyst, and this is an axial scan of fetal abdomen, and the spine shows the posterior aspect. You see two cysts. One should be bladder or other should be a cyst. So we have seen many cases in the of cyst in the fetal pelvis as image to diagnosis, and in first this one turned out to be hydrocolpus, and second turned out to be persistent urogenital sinus, and third was duplication of rectum, and fourth, I mean, fetal pelvis, fifth ITD was URSM sequence with a rectourethral fistula. Now here you see the cyst in the fetal pelvis, sixth in the series, and what what does it turn out to be? If you are interested in knowing the workup of this fetus, please log on to sonography.in. Go to image to diagnosis fetal medicine, cyst in fetal pelvis, sixth in the series. Thank you.